Welcome to Mental Health Matters, a compelling series brought to you by Ontario Shore's Centre for Mental Health Sciences. Every week, we share stories of hope, recovery, and resilience, accompanied by expert advice and resources to help navigate and understand the complexities of mental health. Situated on the shores of Lake Ontario, Ontario Shores is a dedicated public teaching hospital. We provide specialized assessment and treatment services for those living with complex and serious mental illness. Our unwavering commitment to exceptional patient care is built on safe and evidence-based approaches, ensuring successful outcomes through clinical best practices and cutting-edge research. From adolescents to geriatrics, our recovery-oriented environment fosters discovery, recovery, and hope. Mental Health Matters is an opportunity for all of us to learn, grow, and support each other on this journey of well-being. Each episode focuses on breaking down the stigma surrounding mental health through crucial conversations and fostering empathy within families, schools, workplaces, and communities. Join us as we embark on an exploration of the topic of mental health. Together, we make a difference.
Hello and welcome to Mental Health Matters. I'm Julie Van Hardingsveld and I'm your host. I'm excited to bring you a truly unique and interactive experience that allows you to participate from your own home. Today's episode focuses on a compelling workshop that embodies the essence of transformative mental health care. PeaceLove is a workshop that began with the vision of cousins Matt Kaplan and Jeff Spar. Their goal was to change the way society thinks about mental health by creating an environment that values creativity, self-expression, and the power of storytelling. PeaceLove launched as a remarkable creators program in 2015. This initiative provides tools for frontline professionals to implement expressive arts curricula into their communities. This innovative program has positively impacted the lives of over 80,000 people in 27 states across the United States and into Canada. What's more inspiring is one of these incredible creators works right here with us at Ontario Shores. Maureen Patterson, a dynamic member of the Ontario Shores communications team and webmaster, generously gives her time to lead these transformative PeaceLove workshops for staff and patients. Let's prepare to be captivated by PeaceLove and Maureen Patterson's journey as we explore the power of expressive arts in the world of mental health care. Over to Maureen.
Hello and welcome. We are today doing an interactive episode of Mental Health Matters. I'm joined today by Mike Simon and Shauna Moore, and I'm Maureen Patterson. And today we're doing an expressive arts workshop. We hope that you can join from home. We're going to be doing this workshop today along with you. And so if you're at home and you'd like to join along, you can go grab a loved one and do it together with them, or you may be able to do this in a group, such as a classroom. You might be wondering, what is expressive arts? So expressive arts is really just using various forms of art to make ourselves feel better. Sometimes we don't have the words to express what we're feeling. And so art gives us just another avenue to share how we're feeling, just another sort of a language to share, or even just to self-reflect. So if we just compare this to other art forms, so if we create a painting that goes up in an art gallery, or if we have a dance performance or a music performance, those things are all really about the final product, right? Put a lot of work in planning and finalizing the final product. But expressive arts really has nothing to do with the final product. We don't care what the final product looks like in expressive arts. It's really the process of going through these workshops of the creation of the art and the sharing of your artwork. That's what's important here. It's the creating of the art that we hope can help us self-reflect or bring more awareness to our feelings. And so, as I mentioned, it's not always visual arts. It can be movement. So just moving to make ourselves feel better, or, just humming along, just doing some music or percussion in different ways can help us bring more awareness and feel better. An important distinction, though, is this expressive arts is not art therapy. Art therapy is usually creating artwork alongside some traditional therapy, like psychotherapy. And in art therapy, we're sort of working towards goals with measurable outcomes. Expressive arts isn't that. Where it's really just personal. It's really personal to you, and just getting your feelings out onto the canvas, really. So a little bit about the organization that created these workshops. They're called PeaceLove. PeaceLove is an organization out of Rhode Island, and they developed, I think, up to 10 workshops now. They developed the workshops and then trained facilitators like myself to deliver the workshops. And they're a really wonderful organization. A couple of things about them: we can't charge for these workshops. They're really completely nonprofit. So you often see them embedded in organizations like this one, in a mental health hospital. They're also big in corrections organizations now, and children's hospitals, and really in any of those organizations where they're really most needed. So let's get to it. I wondered if Mike and Shauna, I just gave you a brief introduction, but I wondered if you could, before we start, let us know your name and your role, any role you have here at Ontario Shores, and if you could share something that brings you peace of mind. And I'll start. I mentioned I'm Maureen Patterson. And I work on our communications team. As I say, I'm not a clinician, I'm not a therapist, I'm not a rec therapist. I work in communications. And something that brings me peace of mind is pottery. I love doing pottery, just my hands on the clay and centering it. I feel it really centers me and lets me forget about my troubles and grounds me. So that's my thing. Anybody want to? Shauna?
And I'm Shauna Moore. I'm the Diversity, Equity, and Inclusion Lead here at Ontario Shores. And being anywhere in nature gives me a sense of peace.
Hi, I'm Mike Simon, and I'm a former patient of Ontario Shores, and currently I'm a volunteer. When I was a patient here, part of my therapy was to learn how to do art, and I totally enjoy doing that. That's where I go for my peace of mind now.
Awesome. Thank you, guys. And thank you so much for joining me today. When we're doing expressive arts, we really make ourselves vulnerable because we're working through emotions, we're working through personal things that we often just deal with internally and don't externalize. And so in these workshops, we become quite vulnerable, and it can be intimidating. I know that you're an artist, and so you're comfortable doing art, but not everybody always is, right? And the important thing to remember in expressive arts is there's no such thing as being an artist or being creative or not being creative. Everyone is able to express themselves in their own personal way, and any which way that we express ourselves is wonderful, is good and right? And so I just wanted to thank you again for being here and being vulnerable, but please don't worry that this is an open space. And we want to make sure that everybody is comfortable to share in these workshops. So I wondered if we could just start a little discussion as to what are some things that we can do here as a group, or what can people at home do before they start an expressive arts workshop to make sure that the environment is safe, comfortable, and people are willing to share. Ideas?
That's a good question. I would say, that just concentrate on the art itself and do it. You're not trying to impress anybody, right? You're just doing it for yourself, and just let it flow.
I love that. Thank you so much. Yeah. Good.
And I would say just be open to the people that you're sharing the space with, that they've had different experiences and they have different ways of expressing things. So it may not be exactly what we might envision, but they've come from a different place and they've had different experiences from us. So we need to be open.
Yeah. Very good. Very good. Exactly. A couple of things to add. We don't want to interpret other people's art. So as you said, Mike, just focus on your art. Just worry about yours. We're not trying to look at other people's art and say, oh, it looks like you might mean to say that, or try not to interpret others. Really, just focus on your own work. If you are interested in talking with someone about their work, ask open-ended questions. And just be open to listening to their story, because everybody's process is different. So we just need to respect their process. All right, so I think we are ready to jump into this workshop today. The workshop we're doing today is called Dual Emotions. And so we're going to think through a time in your life when you've had more than one emotion at once, because emotions are not tidy. They don't come in a nice, neat box. They can be kind of fuzzy, and you can have multiple at the same time. And so we're human. We're complicated people, and so our emotions can be complicated. So what we're going to be doing, I'll just show it first. We're going to be using two different sides of a face to represent our two different emotions. Okay. If you wanted to grab a third one, you could too, right? There's really no right or wrong way to do this. So you can choose colors that represent those different emotions, and we're going to be putting them onto a backdrop. I just have a couple of examples because there is no right. I'll just hold that up for you. So we're going to be gluing them onto a page like that. But you could, if you wanted to, face them away from each other, if that symbolically meant something to you. Or face them away from each other altogether like that. That works too. I have a couple of examples. And then we're going to be using our art supplies here to embellish them and just work through our art. Here's an example that someone made. This right side for me, for them represented anxiety. And then the other side represented sort of pride and how far they've come. And then another one here, just to show you a different example of the kinds of materials you can use. If you don't have these faces like this, you can just use a paper plate, cut it in half, or even something as simple as a white piece of paper folded down the middle. You can use that with just a pen. You don't need fancy materials like we have here. Just something simple, and you can represent both sides. This one was representing, somebody very busy and overwhelmed, and then, the side that they wish they had, like more organized and compartmentalized. And here's an example of a template that you could use. You could just draw an oval, draw a face down the middle, cut it out, and there you have your two sides. All right. Okay. So those of you at home, this might be a very good time for you to go run and grab some materials. Like I said, just like some pieces of paper and a pen is enough. But if you have other materials, even paint, we have markers today. We have oil pastels and chalk pastels. And then we have a bunch of embellishments. Some people are not comfortable drawing, and they would rather use stickers or glue on different things that represent different parts of their story. So what else can I tell you? So those of you at home, feel free to pause the video at this point while you run and go get your materials and then come back. But we here are going to continue on. And so Shauna and Mike, I wondered if you could go ahead and grab your colors or whatever makes sense to you.
Would you like, okay.
And we have some glue on the table, so we can start
All right.
assembling our work.
Yes.
Yeah. And you may want to, when you're at home working on this, you may want to put on some music. It's nice to sort of just have some quiet time while you do this. You may like to do it and have conversation at the same time, but in a large group, you probably want to have some quiet time, some music playing, so that each person can, have that quiet time to process what they're working on. Does everybody know what they're working on? What emotions they're working through today?
Kind of do.
Yeah. I feel like I do.
I feel like I do.
Maybe,
I don't know how it's going to
I
turn
have a general
out.
idea, but I need to narrow it down a little bit.
No idea how it's going to turn out.
I'm going to go for those chalk pastels. Those are my favorite.
Mhm.
Do remember that we don't need to be realistic. As we mentioned, there's no such thing as being a good artist here. Stick figures are perfectly fine, as I'm doing right now. And, even if you don't want to draw specific things, you can have colors represent people even. You can have shapes representing places. It can be very abstract, really whatever works for you.
I'm still trying to visualize the face part here, so I might have it upside down. Oops. And I forgot this. Back in the good pile. Oops. Just to be silly.
Getting right in there.
Yeah.
All right, welcome back, everyone. We've been busy here creating our artworks, and I think we're nearly done. I think we are done. So I hope at home that you were able to pause the video and work along with us, and you have some wonderful works of art in front of you, and that you enjoyed this process of creating. We're actually going to be moving into a sharing phase of this workshop now. And it's important when we're doing the sharing that we all know we don't have to share if we're not comfortable sharing. Expressive arts is really just about personal expression, and you don't have to do the sharing component. We do encourage you, though, to challenge yourself. It is healthy to share. It is good to get it out and speak to someone. So challenge yourself, but at the same time, just take care of yourself first and only do what you're comfortable with. And while others are sharing, just be sure that you're listening intently and not interrupting. So there's two different ways that we can do the sharing in this workshop. I recommend if you're in a large group at home, if you're in a classroom or something, do it this way. So you would partner up with someone. So let's say I would partner with Mike, for example. And this works best when there's an even number. And we would explain our artwork to each other, just in a small group setting, right? So we would talk to each other about our work. But then you would have to describe your patient's artwork to the group. So this just adds another sort of level of ensuring that you're really listening and you're trying to represent that person's story. Do it justice. You're trying to tell their story as they told it. So that's a really nice way to do this sharing portion. The other way is to just share your own work, which is the way we're going to do it here today. We're just a small group. We're just 3 people. So I think that's the way that it's going to work best for us today. So I think maybe I'll go first, if we don't mind. So I'll share my artwork. So for me, they both sides represents the same thing, really. They're just things in my life, but different perspectives of the same life. It's kind of like, this is one life, this is my life, and this is also my life, but looking at it in 2 different frames of mind, I guess. So in this one, I've got my family, I've got hobbies, I'm sort of a soccer ball here. I coach soccer, and I've got work, and I like being by the water. So we have a family cottage, so there's being by the water, but it's a very relaxed way of looking at my life. Like, my life is awesome, right? With all those things in it. But this side, if I'm in not such a good mood, I feel like it's so overwhelming. There's too many things going on. I have my family, I have this, I have that. And so, yeah, so that's just where I was going with that, trying to make it look kind of busy and stressful, but it really is all the same life and just a different frame of mind, I guess, is where I was going with that.
That's very good.
Thank you.
Mm-hmm.
Anybody else want to go next?
Go ahead, Mike.
Oh, you want me to go next? Okay. So this is very personal for me. In 2016, my son died by suicide. And this represents how my life was and how it still is after such a tragic event. Usually I take a month to paint a picture, so this is just just winging it. But that's what this is all about. So on this side, this represents how my life was shattered, and you see the lines like broken glass. So my reality was totally shattered. And I became a patient here at the hospital because I became depressed and I had anxiety. And the colors are like water, nature, sky, sunny skies. This was before, and I'm looking through this broken glass or broken reality at what used to be. And on this side is where I landed. This is the darkness, the despair. And this is the path forward where I was trying to go back to my old reality, which, as we all know, is impossible, because once something like that happens, you can't change it, But I'm still putting these pieces back together, and I will for the rest of my life. So it's not the Mona Lisa, but it's very meaningful. It's very meaningful to me.
Thank you
to
so
be
much.
to be able to let that out and to express it, right?
Mm-hmm.
Yeah.
Thank you so much, Mike,
Okay.
for sharing.
Thank you.
Thank you for sharing.
Mm-hmm.
So I guess it's my turn. So mine is, I put the 2 pieces close together because quite often those 2 things are happening at the same time. So I think this side here, the blue side, is me overthinking and, just getting, sort of stopping myself and not letting myself be creative and, thinking, is this the right way to do it? Should I be doing this? Maybe reflecting too much. So yet, I chose bright colors because it's not like a dark it's not necessarily dark. It is bright. There are some bright thoughts. So the swirling emotions, sort of thinking about that. And then on this side, I have flowers and butterflies and sort of sun's rays. So after losing my mom about 12 years ago, I started taking a lot of nature photography that was helpful to me, that gave me a sense of hope. So I often stop and take pictures of flowers, and up until that point was never interested in didn't really pay much attention. And so this side represents hope, moving forward, leaving these, recognizing that these emotions exist, but then moving forward with the sun's rays in terms of hopefulness and brightness. And I've put I've put a basketball and a football there because there's a part of me when I'm feeling hopeful and thinking about growing and expanding, wanting to pursue some form of team sport or athleticism, because that's something that was never part of my life. So that's me.
Thank you so much,
Excellent.
Shauna. Thank you so much. Thank you so much to both of you for being here today and participating. I know some things can come up sometimes that you didn't plan on talking about, and they just through the artwork they come out, right? So I do hope it was helpful.
I find it very therapeutic.
Oh yes. Okay. Good. Very good. Yes. All right. Well.
Yeah.
I think that's it for us today. I hope at home that you take this time to share your artwork, and don't feel like you might want to put it up in your room or put it up somewhere. But do remember that you don't have to if you're not if you've experienced the process, and that's enough. And so you don't have to keep this. You can throw it away if you want to. It really is about creation and expressing ourselves. So thank you so much for doing that. If you want to learn more about expressive arts, you can reach us at Ontario Shores at our communications email, communications@ontarioshores.ca. If you want to learn more about the PeaceLove program itself, you can reach out to them at peacelove.org. And we hope you enjoyed this. Thank you.
As we wrap up today's episode, I want to express a sincere gratitude to Maureen Patterson for leading us through a thought-provoking discussion and art project. I also would like to thank our special participants for sharing with us in a very vulnerable way and participating in today's show. Thank you, Maureen, and thank you to our guests.
Hello there, this is Karim Mamdani, and I'm proud to introduce myself as the President and CEO of Ontario Shores Centre for Mental Health Sciences. Thank you so much for tuning into today's episode and for joining us in these important conversations about mental health. I just wanted to take a moment to express sincere appreciation to the incredible team at Ontario Shores for their exceptional work. Our team of compassionate and skilled clinicians and staff work tirelessly to provide life-saving treatment and unwavering support for our patients and their loved ones who are facing the challenging impacts of mental illness. At Ontario Shores, recovery is possible and there is hope. I invite you to visit ontarioshores.ca to learn more about our work. On our website, you can explore our career and volunteer opportunities, learn about our programs and services, and find out how you can make a difference through donations.